Question. For the second to the last question, students were asked to discuss diseases of the bone. Okay, that's in general. Diseases of the bone in general. So disease of the bone is mainly like you are trying to classify what the different disease conditions of the bone. So describing the different disease conditions of the bone, you also try to put out some examples and all of that. So disease of the bone is actually a wide concept, right? So you can have disease condition coming up as a result of poor development. Okay, it's a congenital issue. So things like achondroplasia, where it's a genetic disorder of cartilage formation, so it leads to what? The person being short. So there's issues of dwarfism. Okay, then you can also have osteogenesis imperfecta, where you are having a reduction in collagen synthesis. So this can lead to weak bones. Okay, fibrous dysplasia. Okay, normal bone is being replaced by what? Fibrous tissue. Then cleidocranial dysplasia, that one is defective ossification. Okay, absent clavicles, delayed closure of sutures, and all of that. So you can also have metabolic bone disease, where you are having osteoporosis. There's reduced bone mass. Okay, so you're having weak bones. Okay, it's common in elderly and women that have gone past the menopause time. So you can also have Rickets and Osteomalacia. That one is vitamin D deficiency. If parathyroid hormone is too much, you have issues. Okay, Paget disease, then renal osteodystrophy. All of these are common issues. Then inflammatory and infective disease conditions of the bone have things like Osteomyelitis, where it's usually caused by infection, usually Staphylococcus aureus. Then tuberculous osteomalacia. Okay, then syphilitic osteitis. Okay, that one is like syphilis is spreading to the bones. Then we have the bone tumors and tumor-like lesions. Okay, benign ones like osteoma, osteoid osteoma, osteoblastoma, osteochondroma, and chondroma. Malignant ones like osteosarcoma, chondrosarcoma, Ewing sarcoma, the rest of them. So that's what we got. Tumor-like lesions like cysts. Okay, so bone dysplasias and structural disorders. So things like what? Osteoporosis. Okay, osteitis fibrosa cystica. Then avascular necrosis. Okay, where usually due to blood loss. Okay, blood loss. So that's it on a general, classification. It's more of like a classification of what? Diseases of the bone. Okay.